The director of the White House Office of National Drug Control Policy, Dr. Rahul Gupta, visited WVU earlier today. Michaela Schindler attended that event. She's here in the studio with us now to talk about that. Michaela.
Thanks, Don. Dr. Gupta, along with leaders on the front lines of the overdose epidemic, met in WVU's Health Sciences Center this morning for a roundtable discussion. During this discussion, leaders took turns talking about what they are doing in their communities and schools to battle the overdose epidemic. During the discussion, leaders took turns talking about what they know or are doing in their communities and schools to battle the overdose epidemic. U.S. Attorney for the Northern District of West Virginia, William Eilenfeld, used his time to bring up what drugs are the greatest threats, where they come from, and how it has been a struggle for law enforcement. Dr. Gupta explained that over 90% of synthetic drugs come from the ports of entry at the southern border, in which they usually come in through commercial and personal private traffic.
We have now the ability to have non-intrusive detection technology, scanners, that we want to make sure that they're scanning all of that traffic when it's appropriate to do so. So the president has called out in his State of the Union to have a fentanyl surge that includes implementation of this non-intrusive detection technology. We're working right now at 123 ports of entry to implement that technology.
While this can help prevent synthetic drugs from coming into the country, people are dying now. Dr. Gupta mentioned that while naloxone can be looked at as an enabler, it is meant to save lives first so that those struggling can get help out of their addiction. But where can we find naloxone?
One of the things I'm doing is prioritizing the availability, affordability, and access to naloxone. You will see that on the shelves of your pharmacies by this summer, right next to Motrin and Tylenol. We're bringing all the naloxone manufacturers to the White House to convene a meeting to ensure that we can have accessibility as the first thing right here in West Virginia, where rural areas, difficult to get to, sometimes mom and pop's pharmacies, we want to make sure that they're everywhere.
Dr. Gupta will also be traveling to Charleston tomorrow and Lewisburg on Saturday for more roundtable discussions. Reporting live in the studio, I'm Michaela Schindler for 12 News. Back to you, Don.